alluded to earlier on, the South African Medical Association is rejecting the National Health Insurance Bill in its current form, citing that there had been lack of consideration of the experts' recommendations and concerns as well. Now, joining us on the line, we're joined by SAMA's as chief, or rather vice chairperson, and that is Dr. Mzukwa. Thank you so much for your time. Just give us in a nutshell, maybe looking at the National Development Plan 2030 and where the National Insurance Bill fits into that. Good morning, Dr. Mzukwa.
Good morning to you and to your viewers, and thanks for having me. I'm actually the chairperson of the association and the spokesperson. Ma'am, I think, first of all, I think we need to clarify one thing. As the South African Medical Association, we've been engaging with this bill since 2007, and we've engaged in all the submissions, the green paper, white paper, the policy, the bill in 2018, and the amended version in 2019. And in all those engagements, we've raised issues, because we realize that we've got a vision as the country, but also there are the Sustainable Development Goals by the UN, goal number 3, which actually gave birth to the universal health coverage. So, as the South African Medical Association, we do agree that our healthcare system needs a reform. There's no debate about that. But how that reform comes about is a debate that we're engaging in. And we've made submissions in that regard to the portfolio committee. And we raised issues regarding, first of all, the fact that there has not been any proof of concept in terms of our piloting NHI. There was what they termed piloting that happened between 2012 and 2016. But if you look at that piloting, it neglected very, very serious issues there. It did not talk to the reinvestment mechanisms. It did not talk to the private sector in terms of conducting of the GPs, the actual GPs out there. There's so many elements that were left out in the pilot. So it didn't give us much in terms of how we desired. But the bill itself, leaves out other crucial things. For example, it does not tell our public health sector members, those that are employed by the state, how are they going to be paid in the national health insurance era. Because as we know, the functions of the provinces will be taken to the districts. And currently, those doctors are employed by the provinces. So we don't understand, there's no explanation, there are no engagement that are forthcoming to clarify that issue from that point.
Dr. Mzukwa, just for clarity, yes, I hate to interrupt you, just in the interest of time. You seem to be very well vested in protecting the interests of your members, rightfully so, as the Association of the South African Medical Practitioners. But what about the rights of South Africans who are not able to access private medical care? Are we not dilly-dallying and delaying the process of having universal access to quality health care to South Africans who ordinarily would not be able to afford it?
You are very correct. I'm coming to that point now. The first issue is that, when it comes to the funding, there is no mechanism to protect that fund. It is open up to corruption. First of all, it gives so much power to the minister. And I can tell you what has happened during the COVID-19. Funds were embezzled, in that regard. And we are worried that if we allow the NHI to just go without a watchdog, we are going to face the same problem that we faced during COVID-19. And there are many other examples. But also the issue of NHI is just a funding mechanism that does not talk to other elements of the healthcare system. For example, the issue of leadership and governance. You and me know that the health ombuds has spoken already about incompetence of our CEOs, especially in the province of Gauteng. and I can submit it to you that it is not only Gauteng, it's across the country. So you cannot only choose a funding mechanism and ignore other factors that are in place. The Office of the Healthcare Standards Compliance have released a report that says only 20% of the hospitals can be accredited or are fit to move on to the NHI. So you can tell me what happens to the 80% that is not ready at the moment. The issue of shortages of healthcare workers. We are sitting at 30% of what is estimated to be required by the World Health Organization in our setting in South Africa. So it's not only that we're saying at this point in time, we have not addressed crucial issues that we're supposed to be addressing, to provide good quality, affordable healthcare system, that is accessed by all of us in the country. You are just building on a broken foundation.
But why then would the members of the Portfolio Committee on Health then adopt the bill in its current form? What informs their wisdom in your view?
Our assumption, because there was no engagement that came from that Portfolio Committee, our assumption is that it is politically driven. It is because in 2024 there are elections, to elect the new administration, and this is used as a political football without engaging the stakeholders that have made submissions. SAMA has been making submissions all the time, and this time around we have not received any engagement, from the Portfolio Committee. Not even a feedback, not even an acknowledgement. We made oral presentations so that, we put our points across and be understood by the Portfolio Committee. That we're not opposing reform, we are opposing the how part of it.
All right, Dr. Mzukwa, thank you so much for your time, arguing that the national health insurance is necessary to provide universal health care to all South Africans, regardless of creed, race, or even your financial status. But he says that as it stands right now, this could also impact negatively on the medical aid scheme, in particular, the private sector, and also remuneration for nurses and medical practitioners.